You know how people say your eyes are the window to your soul? Well, I'd argue that your hands are the window to your health. Seriously, as a doctor, I can't tell you how many times I've examined someone's hands and spotted clues that help me make a diagnosis. Today, I want to show you a few fascinating signs and simple hand tests you can try right now that might reveal something new about your body. Just remember, this video is for educational purposes only and shouldn't replace medical advice. Let's start with a classic one, the thumb and wrist test. Try making a fist, but tuck your thumb inside your fingers. Now look closely. Does your thumb stick out past the edge of your hand? Next, take your thumb and pinky and wrap them around your wrist. Can they overlap or even touch? If you can easily do both, you might have what's called arachnodactyly or spider-like fingers. This can be a normal variant, but it's also one of the key signs of a rare genetic condition called Marfan syndrome. People with Marfan syndrome tend to have long, slender fingers, flexible joints, and an arm span that's longer than their height. You might recognize it from stories of tall athletes or musicians with impressive reach, like the composer Rachmaninoff, who could span huge piano chords. But here's the serious part. Marfan affects more than just appearance. It weakens the elastic fibers in the body, which can lead to life-threatening complications like aortic enlargement or even lung collapse. So if you can do both those hand signs and have other features like extreme height or long limbs, it's worth talking to your doctor about genetic testing. Now try another one. Place your hand flat on a table and gently lift your pinky backward. Can it go beyond 90 degrees? What about bringing your thumb all the way to touch your forearm? If your joints move unusually far, you may be hypermobile, super flexible. Sometimes this is completely harmless and even helpful in athletes or dancers. But extreme hypermobility, especially when paired with stretchy skin or frequent joint pain, can be a sign of Ehlers-Danlos syndrome or EDS. EDS is another genetic condition that affects collagen, the protein that gives structure to your skin, joints, and blood vessels. People with EDS might dislocate joints easily or bruise often. Most forms aren't dangerous, but one rare type, called vascular EDS, can cause blood vessels to rupture, so recognizing it early is crucial. Still, don't panic if you're flexible. Most people with bendy joints don't have EDS. Alright, let's talk about the color of your palms, a surprisingly powerful clue. Take a look right now. If your palms are noticeably red, especially around the base of your thumb and little finger, it's called palmar erythema. In some people, this is harmless or even hereditary. It can also appear during pregnancy due to hormone changes. But when it's new, it could point to issues like liver disease or autoimmune conditions such as rheumatoid arthritis. Now, here's something fascinating. Your diet can literally change your skin tone. There have been cases where people who ate excessive amounts of tomatoes or carrots developed orange-tinged palms. That's called lycopenia or carotenemia. Thankfully, it's harmless and goes away when you cut back on those foods. While we're on interesting discoveries, here's one most people have never heard about, your finger length ratio. Take a look at your hand. Is your ring finger longer or shorter than your index finger? This ratio was actually set before you were born, based on how much testosterone or estrogen you were exposed to in the womb. Some research suggests men with a longer ring finger may have a lower risk of prostate cancer, and women with that same ratio might have a slightly higher risk of breast cancer. It's not strong enough evidence for medical decisions, but it's a fascinating biological marker of how hormones shape us before birth. And get this, even your fingerprints might tell a story. Studies show people with circular whorl fingerprint patterns are slightly more likely to develop high blood pressure compared to those with loop patterns. It's still being studied, but it shows just how connected our external features can be to internal systems. Alright, time for another quick test. Press your palms together in a prayer position. Can your fingers and palms fully touch? If not, and your fingers stay bent even when you try, that's called a positive prayer sign. It's often seen in people with diabetes, because high blood sugar can cause sugar molecules to attach to collagen in your hands, making the tissue stiff. It can also cause trigger finger or carpal tunnel syndrome, where nerves and tendons in the wrist get compressed, leading to numbness or tingling in your thumb and first two fingers. Here's a simple at-home check for that. Put the backs of your hands together with your wrists touching, and hold that position. If you start to feel tingling or numbness, especially in your thumb and index finger, it could be a sign of carpal tunnel syndrome. This is common in people who type or use their hands repetitively, like hairstylists, artists, or office workers. Usually, it's treatable with rest, wrist splints, or therapy, but in severe cases, surgery may be needed to release pressure on the nerve. Now, here's one that often surprises people. If your fingers turn white, then blue, then red when exposed to cold or stress, that's called Raynaud's phenomenon. It happens when tiny blood vessels spasm and temporarily cut off blood flow. For most people, it's harmless and just feels uncomfortable. But in rare cases, it can be linked to autoimmune diseases like scleroderma, where the skin becomes thick and tight. Interestingly, one of the medications used to treat it is actually sildenafil, better known as Viagra, because it helps open up blood vessels. Finally, take a look at your joints. Swelling, stiffness, or pain can say a lot. If the small joints closest to your nails, called dip joints, are affected, it could be osteoarthritis or psoriatic arthritis. But if the middle joints or knuckles are swollen, rheumatoid arthritis is more likely. Rheumatologists often map these patterns to figure out what's going on in the body. Sometimes those first swollen joints are the earliest clues to a systemic condition that affects more than just the hands. So, next time you glance at your hands, remember, they're more than tools, they're messengers. They can reveal your circulation, your hormones, your diet, even your genetic story. And while these signs are fascinating, they're not diagnostic on their own. But if something feels new, persistent, or off, that's your cue to get it checked. Your hands are one of the few parts of your body you can observe every day, so take advantage of that. Thanks for watching. If you enjoyed learning what your hands can reveal about your health, don't forget to like, share, and subscribe.